CBC, or complete blood count. Now, a lot of people think this is just regular routine lab. No, that's just too basic. Now, a complete blood count or a CBC is basically a snapshot of what your bone marrow is doing and how our body is handling that stress. Let's fix this misconception, okay? A CBC does not give you a diagnosis by itself. It shows you something called patterns, and those patterns tells us what direction we should think. Now, let's go deeper into our body. Every single thing in a CBC starts in the bone marrow. Now, we call something hepatopoietic stem cells. They divide and mature into three main lines. That is the red blood cell, that is the white blood cell, that is the platelet. Now, let's break it down. Red blood cells carry hemoglobin, and hemoglobin's job is to transport oxygen. So guess what? If hemoglobin drops, oxygen delivery to our tissues also drop. Now, that's when patients feel tired. They feel dizzy. They have shortness of breath. Their heart may start beating faster because it is trying to compensate for the low oxygen. Now, white blood cells, remember, white blood cells reflect immune activity. If neutrophils go up, the body is likely responding to bacterial stress. Now, remember something called lymphocytes. Lymphocytes elevated, you need to think viral. If white cells are also extremely high or extremely low, you need to start thinking about bone marrow problems. Let's talk about platelet. Now, platelets are also a clotting balance over here. Now, too low platelet means there is bleeding risk. Too high platelet means there is clotting risk. Get that understanding. Now, clinically, we don't look at these numbers alone. We look at the pattern. Low hemoglobin with small red cells, let's think about iron deficiency. Now, high white cells with fever, let's think about infection. Low platelet with bruising, let's think about the bleeding concern. So remember, CBC is just not about blood work only. It is a physiologic report on oxygen delivery, also immune response and clotting stability, all in one panel. Very important. Now, we need to always interpret the story. We just don't talk only about the numbers only. My name is Nurse Solomon. A lot of us have to get the deeper nitty-gritty of these conversations. I'm going to see you soon.